Hi, I'm Pietrowski. I'm going to talk to you about heat prevention and total worker health interventions. Currently, your heat prevention programs tend to focus on your warmer seasonal months and provide training solely on your heat-related illnesses such as heat exhaustion, heat cramps, heat rash, and heat stroke. And whenever they train on heat stroke, they tend to focus only on classic heat stroke, which has the main symptom of decreased sweating. And that's an issue because for heat stroke in your occupational setting, you usually see exertional heat stroke, in which workers have continued sweating. So if workers are expecting heat stroke to have decreased sweating, they may not realize that their coworker is actually going into heat stroke because they continue sweating, and that can cause a lot of confusion. Now, one way that employers deal with heat stress and through their heat prevention program is through the concept of acclimatization. And acclimatization is the physiologically adaptation to heat over time. And what employers will do is they give a new employee about 2 weeks to acclimatize by giving them short periods in the hot environment to get used to it. So your typical physiological changes, the main ones are things like higher skin blood flow, decreased electrolyte loss, greater resistance to dehydration, and decreased oxygen consumption. So basically their body systems start to get used to working in that hot environment. And this is very important because it actually allows the employee to continue working and build up a resistance to working in that heat environment and makes them able to do the work. The regulatory guidance for heat prevention programs include the American Conference of Governmental Industrial Hygienists threshold limit values, which use environmental temperature readings to determine work-rest cycles for how long employees can work in hot and humid environments. And then there's the National Institute of Safety and Health, the NIOSH, recommended action levels for unacclimatized workers and recommended exposure levels for acclimatized workers. These also use temperature readings and thermal load levels and a series of equations to calculate how long workers can work. OSHA currently has the Heat Illness Prevention Campaign, which was established in 2011, that has a lot of really good training information for employers and employees. Their motto is the water rest shade that's pictured on the slide. And then currently OSHA has the National Emphasis Program, the NEP, that's under development. It was announced in 2021, late in 2021. And then the OSHA Advanced Notice of Proposed Rulemaking for heat prevention indoors and outdoors is currently out for comment. That is the first step towards an OSHA heat prevention standard, which they will hopefully put out next year. So we're waiting to see what happens with that. Climate change is a big concern for your heat prevention programs. Climate change is causing an increase in observed heat waves and the daily average temperatures. So employers really need to focus their heat prevention programs to continue to protect employees from heat. As the temperatures rise, studies have shown that visits to emergency rooms departments rise, as do the reported occupational injuries and illnesses. They've also shown that heat causes minor symptoms that can increase accidents, and that the heat exposure can cause your long-term effects to employees, but they're not sure what all the effects of that long-term exposure is, so more study is needed in this area. Now, all this brings us to personal risk factors. What are personal risk factors? So we have pre-existing conditions such as heart disease, respiratory disease, any kind of medical disease. And then you have just your physical condition, your age, and then a really big one is a previous heat injury or illness. All these things increase your susceptibility to heat. And things like the drugs that you're on because of your medical conditions and any other substances that you might be using, illegal drug use, alcohol, caffeine use, anything that affects the way your body works and your body system can also affect the way that you react to heat. So studies are showing that not only do we need to consider the environmental conditions of heat, the temperature, the humidity, but we also need to consider these personal risks in order to determine an individual's total risk to heat. So this brings in that concept of total worker health, and we need to take all of this into account whenever we're determining how to best protect the employee in a high heat situation. So what are the knowledge gaps that we have right now? And the first one is, what are the effects of these pre-existing conditions and the medications and these other personal risk factors of the employee? And how do we tie these into our heat prevention programs? What can we do about it? And another knowledge gap is there's a big underreporting of heat-related illnesses and injuries. And a lot of this has to do with the way that injuries and illnesses are reported. Usually the only thing that's reported is the actual injury or illness that caused the incident. So if somebody has a heart attack at work, that's what is reported. They had a heart attack. Or if somebody slipped and injured themselves, that's what reported. The things like it was a really hot day and they were tired, that doesn't get reported. Or if they were outside on a hot day and they were been doing physical labor for 2 hours, and so they overexerted themselves in the heat and then had a heart attack, the heat doesn't get reported as a contributing factor. So it's very difficult to actually run statistics on that because heat isn't mentioned. So this all brings us to that there's just a lack of awareness of the contributing factor of heat in these occupational injuries and illnesses, and yet studies have shown that exposure to heat decreases productivity and that there is an increase in accidents on hot days. So we need more studies and information to tie these things together. Now, some employer recommendations for a total worker health heat prevention program. The first thing we really need is that leadership commitment to total worker health and heat prevention, and we need this within the policies and programs and practices, and we need to be able to modify jobs and shift and schedules during high heat days. We need to really establish that workplace heat prevention program, and we need to do this through doing things like messaging for all employees about what to do during these high heat days, and then messaging for those targeted messaging for your heat exposed employees. And in order to do that, we need to identify those hot and humid work locations and those employees that work in those locations. Now, OSHA and NIOSH have a lot of resources that can help with setting up a really good heat prevention program. And then along with that, you really need a medical monitoring program. And NIOSH has their NIOSH criteria for recommended standard that really goes through how to set up that medical monitoring program that also protects the employee privacy. So employee recommendations are really all based around the employee taking care of themselves and their co-workers, and it's just making sure you check the temperature, making sure you have enough water, that you're drinking the water and staying hydrated, that you're using your personal protective equipment, that you're taking care of yourself and working at a pace that's comfortable for you in the heat, and modifying work practices as you need to, and you're using the buddy system and taking care of each other, and that you're not only doing that at work, but that you're also taking care of yourself at home.